Come on. Gnarly genie dangers, rogue kidneys, and this will make you never want to go fishing again. Today we are breaking down and reacting to all of the gruesome medical scenes and imaginative injuries from Happy Tree Friends number 19. Let's dive right in. Oh man, okay, first off, he's blind, right? So the stick is actually called a mobility cane. They're typically white with a red ending. This is not gonna be good giving a sharp object to the blind guy. Ah, okay. Oh my gosh. How many of you out there have ever dissected a frog? Let me know in the comments. I have. I think it was the first thing I've ever dissected. Oh no. Oh, that's the worst. How many people have had an injury to the foot? It is the worst. Sometimes they bleed like stink, but it's hard to get to it sometimes. Obviously, put pressure on it and actually elevate it. Because it is down, it's just gonna keep pumping. Oh my gosh, oh man. Stuck around the neck, causing asphyxiation, causing decreased blood flow to the brain. Both things can cause you to pass out. Decreasing blood flow to the brain or changing the flow could increase the risk of developing a blood clot, which then can get dislodged and go into the brain, causing a stroke. Bad things can happen. Oh my gosh. Oh my god. Oh. So, I don't know if that's a thing, if there's fishermen out there. Do people use explosives when fishing? We have pieces of the creature just flying everywhere, including half of the head. We got the brain, obviously, the skeleton attached in the sense of we have the vertebrae and we have a single tooth. My classic line, this is definitely not compatible with life.
He's dead, Jim.
Oh, get out. Get out of there. Oh my gosh. Would you trust the moose as your firefighter? Let me know in the comments. Oh, no, electrical. Oh man, fear unlocked right there. Dropping of an elevator. Whew. Come on.
Come on.
Very cool little anatomy we got going on here. We can see the brain, we can see the lungs, and then a bunch of the red stuff. Most of the elevator doors do have safety so they don't get you, as well as there's the inner door versus the outer door. One's actually a part of the elevator, the one is related to the floor that you're actually on. Oh, we got intestines. For all of you followers out there, we know that that string of intestines would be attached by the mesentery and wouldn't necessarily pull apart like that, but it is quite stretchy. Oh, no, 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 no. Oh, man. You can't just be wielding an axe. Broke through the skull, which is pretty hard to do, but this is a big heavy axe and he took a big swing, so that's a great possibility. Right down the center between the two hemispheres. Obviously you're gonna have bleeding, but could the brain be spared? Very interesting. I bet there are case reports out there where people have had brain trauma that went straight through the middle and missed the brain tissue and were able to survive and tell the story. Oh no, you're gonna use that to climb up. Very slimy, very slippery, mucus. When you open up a human for surgery, everything's kind of like wet in there. Everything's moving around and kind of juicy.
Juicy juice.
One from the burning building. We have charred creatures. When the burn is that bad, it's 3rd versus 4th degree burn and then airway compromise. Why do we have a random kidney? That was really funny. We do see a lot of crush type injuries, but the ones that we typically see are extremity crushes, usually work related versus automobile related. Oh my gosh. The moose is trying to do CPR. Great. Check to make sure they're not awake. Check a pulse, listening for breathing, right? Look, listen, feel. And then, obviously, at the same time, you're calling for somebody to get help, and then you do start compressions. Oh. Looking good. Oh, the genie, I love it. A disco ball. Is that what you would wish for? If you had 3 wishes, let me know in the comments what you would wish for. Oh no. Yep. We got forest fires and injuries. Yeah, oh, right into the eyes. Reminds me of bad shows where you're getting laser surgery. And can you actually cause eye damage by lasers? Yes, you can. Just depends on multiple different factors. And same idea, the laser pens always says like don't shine into somebody's eyes, can cause retinal damage. Ouch. If you survive a crush injury, besides the crush injury aspect, we do worry about the breakdown of the cells of that area. When you crush cells, you have a higher concentration of potassium, then you actually can cause cardiac arrhythmias. Oh, we got the genie again. Sweet. Oh, you have that great of a grasp on the lamp that they're able to rip your arms off. Crazy. So remember, the forearm has 2 bones in it. It's got your radius and your ulna, versus then the upper part of the arm that's still attached. We have the humerus there. So what would you do?
What would you do?
If an individual had their arms ripped off, you need to stop the bleeding. Direct pressure first. If you can't get it stopped with direct pressure, tourniquets. Don't just jump to the belt right away. See if there's something fabric and that you can twist. If you still have the amputated parts, please bring them with you. Shards of glass flying at you. They're stuck inside. Your first instinct is to grab them and pull them out. Even if they're gonna cause you to have a laceration on your hand, please be careful. Some of these are gonna be super deep and might cause worsening bleeding, and then you're gonna bleed out before you even make it to the hospital system. Oh, little honeybees. Do you know honeybees are so good for our environment? Please take good care of them.
Covered in bees.
Oh. Got honey on the face. Honey is delicious. It's so good. It's actually anti-inflammatory and it helps with people's allergies. I'll just wipe it off. Oh, we got an animal. Oh my gosh. Yep. Knew that was gonna happen. Oh man. Slices. You got the bear claws that went all the way through, but yet the spinal cord's still intact. We'll let that go. But it's interesting, when we do CT scans, we do it like that, where they're actually slices. They're typically 5mm slices. So you're actually missing some information. Oh no, they did a good job. They went all the way through, so that's good. If you're like me and you want some calm vibes after watching all these woodland creature catastrophes, I think you should definitely check out Chillax by my company, Life Happens. Check out Chillax at lifehappens.com as well as Amazon. Oh. We talk about this often on this channel, having to do with trauma, falling from great heights, greater than 3 times your own height, greater than 15 feet. But these are massive falls. The survivability of these are super low. They're landing on stones and rocks and getting impaled. There's not much to say there. Okay, obviously, we have a plank into the buttocks.
In the buttocks.
Buttocks is made up of a lot of big muscles, your gluteus maximus. Yes, actually, that is a word. Most likely it's a soft tissue injury, but we always worry about the pelvic bones as well as the femur itself, and probably your sacrum and your coccyx. If somebody comes in with this type of impalement, you will make it shorter, probably get some imaging, and then thereafter, get it removed. Obviously, pain medication, probably a trauma surgeon will do some anesthetizing around the area to maybe make it feel a little bit better besides regular pain medicine. Oh, we see exposure of bone. That is an open fracture. That's what we call that. Very simple terms. We call it that way because we want to classify, is it closed or open? Is there an increased risk of infection? Poor prognosis, poor outcome. So I think they're doing a good depiction. People try to get close to these nice furry animals, but it's probably not the smartest thing to do. They are still wild animals, and if they feel threatened at all or hungry, they're gonna come after you. Oh, we got a ski slope. We got the classic lift without the safety bar. Just be careful on those, no sudden movements. Oh. Oh my gosh. Oh, come on. Come on! This actually does happen more often than you think, that people come to the emergency department, it goes right through a shoe, and then you worry about the Pseudomonas infection, you worry about puncture wound. Not that far-fetched. When you bleed, if you take a little bit of your blood and put it in a gallon of water, that whole thing's gonna be bright red. So same idea, right? Snow is just water. Oh, ripped right through the foot. Ouch. Sometimes this can happen pretty easily, especially if the object is going in between the metatarsals, so the bones of the foot. It could rip through. We've seen that before. Typically, as long as the nerves are intact, this can be repaired. Don't just scream, put pressure on it, elevate it, and probably the easiest way is to actually try to close it back up and put pressure on it that way. Happy Tree Friends. It's so creative. From an adult show standpoint, it's quite funny if you take it from that side of things. So if you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.